Vaishnavi, may I know your name, please?
Varsha.
And your age?
18.
Okay.
Inspect the auricle and the surrounding tissue for deformities, lumps, or skin lesions. If ear pain or discharge or inflammation is present, move the auricle up and down, press the targus, and press firmly just behind the ear. To see the ear canal and the eardrum, use an otoscope with the largest ear speculum that inserts easily into the canal. Position the patient's head so that you can see comfortably through the otoscope. To straighten the ear canal, grasp the auricle firmly but be gentle and pull it upward, backward, and slightly away from the head, holding the otoscope between the thumb and the fingers. Now, insert the speculum gently into the ear canal, directing it somewhat downward and forward. Inspect the ear canal, noticing if there is any discharge or foreign bodies, redness of the skin, or swelling and cerumen, which varies in color and consistency from yellow to flaky brown. Inspect the eardrum, noting its color and contour. The cone of the light from the otoscope helps to orient you. Identify the handle of the malleus, notify its position, and inspect the short process of the malleus. Gently move the speculum so that you can see as much as the drum as possible, including the pars flaccida superiorly and the margins of pars tensa, and look for any perforations. To begin screening, ask the patient, do you feel you have a hearing loss or difficulty in hearing? If the patient reports hearing loss, proceed to the whisper test.
I am standing 2 feet behind the patient. Can you please occlude the targus in circular motion? Okay, please turn that side. 6,
6, 8, 3. 4, E, 1.
Okay, good.
Place the base of the lightly vibration tuning fork firmly on the top of the patient's head.
Please let me know when you hear it.
I can.
Both the ears or only the one ear?
Both ears.
Okay.
Palpate the mastoid bone and place the tuning fork on the bone. Immediately place the tuning fork near the ear canal.
Make sure the patient is seated 20 feet away from the chart. Please cover your right eye with this cardboard, which is the smallest line you can see.
5.
Can you please read aloud?
HALTRUD.
Cover your left eye, which is the smallest line you can read.
5.
Read them aloud.
HALTRUD.
Okay, that's good.
Ask the patient to look directly at your eye or nose and test each quadrant in the patient's visual field. Ask them to read out the numbers which you are showing. Wiggle your fingers and slowly bring your moving fingers forward into the patient's center of view. Place a red-topped pin beyond the ear and move the pin inward from beyond to the boundary of each quadrant. Stand in front of the patient and survey the eyes for position and alignment. If one or both eyes seems to protrude, assess them from above. Coming to the eyebrows, inspect the eyebrows, noting their fullness, head distribution, and any scaliness of the underlying skin. Now the eyelids. Notice the position of the lids in relation to the eyeballs. Inspect if there is any edema of the lid. lids, color of the lids, lesions, and width of the palpebral fissures, and condition and direction of the eyelashes. Briefly, inspect the regions of the lacrimal glands for swelling. Look for excessive tearing or dryness of the eyes. Ask the patient to look upward as you depress both the lower lids with your thumbs, exposing the sclera and conjunctiva. Inspect the sclera and the palpebral conjunctiva for color. In a normal patient, the sclera is white in color and the palpebral conjunctiva appears pink. I am placing the object in front of the patient and start moving the object closer to the patient. You will notice the pupil constricts. Place the light oblique to the eye. Look at the specific pupil if it constricts. Again place the light at the same pupil. Now observe the pupil of the opposite eye. I am holding the pen about 10 cm from the patient's eye. Can you please look alternately at the pen and at the distance directly behind it? At the pen, behind, at the pen, behind. That's great. Ask the patient to follow your finger as you sweep through the 6 cardinal directions of gaze, making a wide H in the air